All right, everybody, get ready, because today we're going deep into brain surgery.
For pets.
You heard me right. We're talking about the incredible skill it takes to actually operate on an animal's brain.
Yeah. It might seem like something out of a sci-fi movie, but it's a growing field, And it's driven by all these advancements in VED and also a deeper understanding of neurological conditions.
We're going to be using a really cool article to guide us today. It's called Complications in Intracranial Surgery of Companion Animals by Andy Shores and Michelle L. Mendoza.
Now, I know that title sounds a little intimidating, but stay with us.
By the end, you'll have such a solid grasp on this complex field. And I think a newfound appreciation for these amazing veterinary neurosurgeons.
Absolutely. And you know what? Even if you're not a veterinarian yourself, you'll find some surprising parallels to human medicine, especially when we talk about those preventative measures.
So let's just start with the basics. Why would a pet even need brain surgery?
So many reasons. There's traumatic brain injuries, like if a pet gets hit by a car or has a bad fall, to congenital malformations, which are like birth defects of the brain.
Yeah.
And of course, there's the growing concern of brain tumors.
Especially in our older pets.
Right.
The article mentions meningiomas are a common type of brain tumor in older animals.
Yeah, meningiomas arise from the membranes that surround the brain and the spinal cord. And they can cause a whole bunch of different neurological problems depending on their location and size.
It makes you wonder if our pets are kind of mirroring what's happening in humans with an aging population and the increase in medical conditions.
That's a great point.
So we know why brain surgery might be necessary. How do they get to the brain? I mean, it's not like you can just crack open the skull.
Well, that's where it gets really interesting.
Tell me more.
There's these three main surgical approaches that are used to access the brain. There's rostrotentorial, transfrontal, and suboccipital.
Those are some big words.
They are, but they're important to understand because each approach gives access to a different part of the brain.
So it's like a roadmap for navigating this incredibly complex organ.
Exactly. Like, imagine the brain as a walnut with all its folds and crevices. The rostrotentorial approach lets you access the front and middle parts of the brain.
Okay.
The transfrontal approach, as you might guess, goes in from the front near the forehead. And then finally, the suboccipital approach that gets to the back of the brain where the cerebellum is located.
Wow, it's like they have to choose the right path to get to the problem.
Exactly. And that choice depends on a number of factors: the location of the problem, the size, and the surgeon's experience.
The article actually even has pictures of these approaches. Figure 1.
It does. And if anybody listening wants to see what these surgical routes look like, you can check out that figure.
Okay, so we've established why and how.
Yeah.
But let's be real. Any surgery, especially on the brain, comes with risks.
Absolutely. Intracranial surgery is inherently delicate.
What are some of the complications that can arise?
So many things can go wrong.
Oh, no.
But one of the biggest concerns during surgery is brain swelling. It's also called cerebral edema. This can happen because of the manipulation of brain tissue changes in blood flow or even as a response to the anesthesia.
I can imagine brain swelling would be super dangerous, especially in the skull.
It can. It can compress important brain structures and lead to neurological problems.
And then on top of that, there's always the risk of bleeding during surgery.
Absolutely. The brain has such a rich blood supply. Any little nick or tear in a blood vessel can cause bleeding inside the skull.
I remember the article had an example of this, a collapsed cortex following the placement of a ventricular catheter. And that was figure 2.
Powerful image, right?
It really shows how delicate these procedures are.
Every little step matters.
It sounds like the challenges don't end when the surgery's over, though.
You're right. The post-operative period is just as crucial.
Like what kind of complications happen then?
Well, one of the big ones is aspiration pneumonia. This is when food or liquid or even vomit gets into the lungs, and it can lead to infections and breathing problems.
So why is that a risk after brain surgery?
It has to do with the medications that are used to manage pain and sedation after surgery.
Makes sense.
Things like fentanyl and benzodiazepines, they can increase the risk of aspiration.
So it's like this balancing act.
Yeah.
Managing pain, but also minimizing those risks.
Exactly. And it's not just aspiration pneumonia. We have to watch out for seizures, infections, nutritional deficiencies.
Figure 3 actually shows a case of post-operative hemorrhage that needed another surgery.
Yeah. Emphasizes how serious these complications can be.
So it's not just about the surgery itself. It's about the prep, the anesthesia, and the aftercare.
All of it.
We'll be back after a quick break to explore the world of prevention and post-operative care in brain surgery for pets.
Welcome back.
So we've talked about why pets might need brain surgery, the different ways to get to the brain, and even those scary potential complications.
Right, and that brings us to a really important question. How can we prevent those complications?
Absolutely. The article emphasizes a multi-pronged approach, starting with pre-surgical planning.
It's all about that groundwork, like a chef prepping all the ingredients before starting a complex recipe.
So we're talking medical history, neurological exam, and advanced imaging.
All of it. CT scans, MRI scans, you name it. We want to gather as much information as possible.
To minimize surprises?
Exactly. And then there's anesthesia.
Oh, right. Anesthesia plays a huge role.
It does. And there's actually an ongoing debate between IV and inhalant anesthesia.
Oh, I've heard about this in human medicine, too.
Yeah, there are definitely parallels. Propofol is an IV anesthetic known for its fast onset and recovery time, which can be really helpful in brain surgery.
So less time under anesthesia.
Right, and less impact on that intracranial pressure.
Okay, so what about inhalant anesthesia?
Well, some experts prefer inhalant anesthetics like sevoflurane because they offer better control over the depth of anesthesia.
I see.
The article even mentions that some surgeons like to combine the two, like using sevoflurane with something like short-acting opioids or dexmedetomidine.
Trying to get the best of both worlds.
Exactly. It's about tailoring the plan to each patient and the procedure.
That makes sense. So we've got planning and anesthesia.
Yeah.
What else is important for preventing complications?
Managing that intracranial pressure is key, and it's important during and after surgery.
Right. We were talking about brain swelling earlier, so how do we address that?
There are medications that can help, like dexamethasone, mannitol, hypertonic saline.
So dexamethasone, a corticosteroid, helps reduce inflammation.
Exactly. And then mannitol and hypertonic saline, they work by actually drawing fluid out of the brain tissue.
Wow. So it's not just about giving medication. It's about constantly monitoring the patient's neurological status.
All the time, throughout the whole thing. And that monitoring extends to pain management and sedation after surgery, too.
Right. Because we talked about the risk of aspiration pneumonia with opioids. What are the alternatives?
The article talks about a multimodal approach to pain management to try to use fewer opioids.
Okay.
So that might mean using things like IV of avenifin, dexmedetomidine, or even ketamine, either alone or with opioids.
So again, finding that balance.
Always. And for specific surgical approaches, there are even more preventative measures.
Like what?
Well, for the rostrotentorial approach, some surgeons prefer doing a craniectomy instead of a craniotomy.
What's the difference?
So in a craniectomy, they remove a portion of the skull, but in a craniotomy, they just create a bone flap and replace it later.
Okay.
A craniectomy gives more room to work and can help reduce pressure on the brain, which can be super important when there's a lot of swelling.
And I remember the article talked about using polypropylene mesh to protect the brain and prevent adhesions.
Yeah, that's figure 5.
And what about the transfrontal approach?
Well, one of the main concerns with that approach is contamination from the sinus cavity.
Makes sense since they're so close together.
Right. And that contamination can lead to infections like pneumocephalus or subcutaneous emphysema.
Those sound bad.
They are. And the article goes into detail about all the careful steps that surgeons take to prevent that contamination.
Wow. It's amazing how much precision goes into all of this.
It really is. And then another preventative measure is managing seizures.
But what if the pet hasn't had seizures before?
That's the thing. They might start them after surgery. So the idea is to be proactive and start anti-seizure meds like levetiracetam even if they've never had a seizure before.
So prevent them from happening in the first place.
Exactly. And usually this involves weaning them off the medication after 6 months if they haven't had any seizures.
Wow. So we've talked about planning anesthesia, surgical approaches, seizure management. It seems like vets are doing everything they can to minimize those risks.
They really are. And it's not just about those technical aspects. It's also about making sure the patient's overall well-being is being considered.
Right. And speaking of well-being, we can't forget about nutrition.
Absolutely. It's so important for recovery.
But why? I mean, it's not a broken bone that needs specific nutrients to heal.
True. But nutrition is essential for supporting the body's natural healing processes. It helps boost the immune system and provides energy for recovery.
This is all about giving the body what it needs to bounce back.
Exactly. And after brain surgery, it can be a challenge to make sure they're getting enough nutrition.
How so?
Well, some patients might have trouble eating on their own because of neurological problems or pain. Some might have changes in their metabolism or need a special diet.
So what can be done?
The article emphasizes early intervention and working closely with a veterinary nutritionist.
Makes sense.
That might involve using feeding tubes, tailoring the diet to their specific needs, or even using appetite stimulants.
It sounds like nutrition is a crucial piece of the puzzle.
It really is, and it highlights the importance of always looking for ways to improve.
I like that. So how does that apply to brain surgery for pets?
Well, even with all the advancements, there's always room to do better.
Of course, medicine is always evolving.
Exactly. And veterinary neurosurgery is no different. The article mentions a few areas where more research is needed.
Like what?
Well, one area is post-operative vascular events, specifically ischemic strokes. It's been studied more in humans, but not as much in animals.
Right. And I remember earlier we talked about the link between high blood sugar and stroke risk.
Exactly. That's one thing to look into. The article suggests that high blood sugar might increase the risk of strokes after surgery, but we need more research to understand this in animals.
So more research is needed.
Absolutely. And it shows how connected human and veterinary medicine really are.
What we learn from one can help the other.
Absolutely. And speaking of connections, that brings us to another important aspect, the human-animal bond.
Okay. How does that tie into brain surgery?
Well, it's a very technical field, but at its core is compassion and recognizing that bond between humans and animals.
So it's not just about treating the animal, it's about supporting the owner, too.
Exactly. Veterinary professionals need to be able to explain things clearly to pet owners about the surgery, the risks, the benefits, and what to expect during recovery.
So guiding them through a stressful time.
Exactly. And the decision to even have brain surgery for a pet is a tough one.
It is. It's a big surgery and a big commitment.
And that's where that human-animal bond comes in. Vets need to be sensitive to that bond and the impact the pet's illness has on the whole family.
So approaching each case with compassion and understanding.
Exactly. And that brings us to the amazing dedication and skill of these veterinary neurosurgeons and the entire team.
It's incredible what they can do.
It really is. They're constantly learning and improving and fighting for the best care for their patients.
It shows how far veterinary medicine has come.
Yeah.
But before we get too ahead of ourselves, there's one more thing we need to talk about.
The ethics.
Exactly. Just because we can do something doesn't always mean we should.
Right. We need to be thoughtful and have open discussions. And always put the well-being of the animals first.
So stay tuned for part 3, where we'll tackle those ethical questions head on and wrap up our deep dive into the amazing world of brain surgery for pets. Welcome back to the final part of our deep dive into brain surgery in companion animals.
We've covered so much ground, from the technical stuff to preventative measures to that constant drive for improvement.
It really has been an incredible journey. But as we wrap up, we need to talk about those ethical considerations.
Absolutely. Because as technology gets better and we can do more and more, we really have to think about what we're doing and make sure we're always putting the animal's well-being first.
And one of the things that comes to mind is informed consent.
Right. Yeah.
In human medicine, patients have the right to make their own decisions about their health care. But animals can't exactly sign a consent form.
That's true. So in those cases, the pet owner has a really important role.
Right. They have to make the decision.
And veterinarians have to make sure the owners have all the information they need.
To make the best choice for their pet.
Exactly. And that decision always has to put the animal's welfare first.
So it's not just about what we can do, but about what's best for the animal.
Right.
Which kind of leads us to another ethical consideration, quality of life.
Yeah.
Just because we can do the surgery doesn't mean we always should.
We have to think about the potential benefits, but also the risks.
And how the surgery will affect the animal's quality of life.
Exactly. Will they be in pain? Will they be able to move and function? Will they still be themselves?
Right. We have to make sure their life after surgery is actually a good life.
And that can be hard to figure out, especially with neurological problems.
It really can be.
Because neurological problems can affect their behavior and how they think,
So how do you assess that? How do you know?
It's a combination of things. Observing them doing a neurological exam and talking to the owner, The owner knows their pet better than anyone.
That makes sense.
Yeah.
And sometimes the best decision might not be surgery.
Sometimes it's palliative care or even humane euthanasia.
Right. If we can't take away their suffering.
It's never an easy decision.
But it's so important to have those honest conversations with the owners.
Absolutely. To help them through such a difficult time.
Another thing we should talk about is experimental treatments.
Right. As the field advances, there are always new techniques and therapies to try.
But we have to do it ethically.
Always. The animal's welfare has to come first.
So careful planning, review boards, transparency with the owners.
It's a balance, We want to learn more to help more animals, but we can't do it at the expense of the animals we're treating.
It's good to know those ethical considerations are so important in veterinary neurosurgery.
They are, because it's a field that's always pushing the boundaries.
But it's doing so with compassion.
Exactly. I think those ethical challenges really show how much we care about our animals.
We want to do everything we can to help them, but we want to do it the right way.
That's it.
This has been an incredible look into a world that I think a lot of people don't even know exists.
It is fascinating.
We've seen the complexity of brain surgery, the incredible skill of these vets, and the ethics that guide everything they do.
It's amazing to see how far it's come.
So from Vet Neurojar, keep those minds inspired, hearts light, and tails wagging.